rather critical to the economy of this county. One being the treasurer, one the auditor, and frankly the recorder, and the clerk of courts. Imagine buying a new car, titling cars, and the like. So that is very necessary. In terms of the treasurer's office, people having business with the treasurer's office are encouraged to conduct business remotely if at all possible. There'll only be one individual allowed in the office at a time. Tax payments will be sent by mail, will still be processed. Treasurer Boland encourages as many as possible to use the online facilities to pay their taxes. If they need a new delinquent tax contract, they can make arrangements by contacting the office via phone. The treasurer is suspending further foreclosure action on occupied structures. Pay-ins, that is maybe a foreign term for many in the public, but that's people that collect fees and so forth throughout the day. They'll continue to accept them, but there will be one person at a time, and that office will apply. Moving on to the county auditor. Auditor Milligan is also applying to one person at a time in the office. There would be no dog tags sold in the auditor's office, only through the website. These will be processed one person at a time. If you were to bring the deed in, leave it on the counter, it will be processed. She would ask that no one wait in the office. Anyone needing to send a homestead application, be aware that you have until the end of 2020 to file them, so you're not in a rush to do so. CAUV renewals can be mailed. A vendor license can only be purchased on the Ohio Business Gateway website. Any questions that you may have of those respective offices, please contact the officer themselves. We appreciate the work of all, in cooperation with all our fellow office holders. While a lot of people believe we have a lot of authority, our authority is limited in the sense that you may see some offices decide to close temporarily or change their hours or stagger their staff. That is beyond our control. Those officers that I have met with have agreed to reevaluate this within the next 30 days. Hopefully things are better and not worse, but these are very unusual times, and we don't want to have people getting sick. So thank you again. Oh, one other thing I would add, sorry, Tim. Rachel Ketterman, our DJFS director, has done a wonderful job for us, and of course she has the most people that would be exposed to this. And there's a couple things you wanted me to mention about we're going to...
I'd like to have her come up and speak.
Hello. As far as the Department of Job and Family Services, we are going to keep our doors open as long as possible. When it comes time to close our doors to the public, we are going to maintain staff in the building as long as possible. A lot of things with public assistance, child support, and children's services can be done on the internet and on the phone. We're going to give that information to you when you leave for those phone numbers and those websites. Children's services is a little bit different because our essential duty is to protect child safety. We will keep our investigators standing upright and healthy as long as possible and able to go out into the field and to do just that, to protect our children. Thank you.
If I could, I'd also like to introduce Marcy Patton, Director of our Mental Health and Recovery Services. Marcy.
Good afternoon. I too want to thank Wes and his staff because they've done an excellent job in this last week keeping us informed and giving us good information. One of the things that we focus on in my office is the behavioral health needs of individuals throughout the county. So in addition to the physical health risks that are associated with the virus, there's a number of behavioral health concerns. And there are certain populations that are probably more susceptible individuals who have a pre-existing mental health or substance use disorder, children and families, individuals that are older, and also our first responders and our healthcare workers, people who can't just stay home, and they need to be there. It's expected that there is going to be some stress and some anxiety around all of these things that we're dealing with each day. And the range of reactions may be varied. Some of the things we may be dealing with is anxiety, worry, panic, feelings of helplessness, social withdrawal, difficulty concentrating or sleeping, anger, disappointment, sadness, irritability, eating too little or too much, thoughts of hurting yourself or others, and hypervigilance to your health and your body. There are so many emotions that kind of go on, and I've heard people who typically do not get stressed over a lot of things who are really anxious over everything that's going on. So during such times, we're just encouraging people to manage stress as best they can. Things like getting good information, limiting your media exposure. We want them to listen to the media, but we don't want them to be, sitting all day long in front of the television, focusing on all of that, because it's just not really healthy. It's really important to stay in touch with families and friends. It's especially important for our older population that people are reaching out to them because we have that social isolation to begin with for many of them, and now they're feeling even more isolated. We have had concerns in our county around suicide rates and overdose rates and epidemics with opioids, and all of those things are at higher risk at this particular point in time. The board is taking measures to ensure that behavioral health services are available to anyone who may need help with mental health and substance use issues. The State Department of Mental Health and Addiction Services has relaxed a number of rules and gotten waivers from Medicaid so that providers are able to provide many of their services via telehealth. And we're working out all the details on that now so that individuals do not have to come into offices to actually see somebody. Even intakes can now be done via the telephone. So there's been a number of changes that have happened. There's all kinds of information and resources out there. I have a packet of information over here with some handouts just on managing worry and stress, and you're welcome to that. We did send out a press release today to all the newspapers and to the TV stations with information. And we're just urging everyone to, stay informed, reach out to people, focus on the positive things you can do. I think sometimes we focus so much on all the scary things about this, and I think we need to be focusing on the fact that people are recovering from this. People who do get this virus, the majority of these individuals are recovering. And we talk a lot about hope in our neck of the woods because we need that hope. And so we're really, wanting everyone to remember that the prevention things, the treatment that we do, those things work, people recover, whether it's physical or whether it's emotional needs, that we're here to help. Our office will also be open and we will be there if people need information about resources. If they have a provider, we encourage them to call their current provider, and otherwise they are free to call the Mental Health and Recovery Services Board and we will direct them to appropriate resources. Thank you.
Thank you, Marcy. I guess at this point, I'd like to make a final statement that how much I appreciate all the partners that we have in our county, that our success to this point and our ongoing process as we address the COVID-19 is certainly credited to the folks that you see here as well as those that you don't. So thank you to everyone. At this point, we'll take some questions. If there were any questions. Yes?
Marcy, did I hear you say that you are staying open then full hours, full staff, or?
Yes, we are at the Mental Health and Recovery Services Board.
Yes, ma'am.
You said you had 10 people tested just this morning. Is that usually the daily you have a good number of people being
No,
tested?
I think
each day?
to clarify, we had, prior to this morning, we had already tested 10. The number of cases that were patients that we've tested today, again, that's an ongoing and evolving number. I don't know, maybe the East Liverpool, if you wanted to talk about that for just a second.
This morning, we did change our guidelines of who becomes tested, and it sort of made it more lenient. And as of today, prior to when I left the hospital, we did have 15 tests today,
Just today?
just today.
Okay. So we don't know how many total have been tested then so far?
That would be 18.
18?
Yeah.
And that 18 would be at the city of East Liverpool.
That's just at our hospital, East Liverpool City Hospital only.
Okay.
In Columbiana County, we have multiple healthcare systems that respond to the needs of our families because of our geographic location. So we see patients that go to the hospitals in Salem. Debbie Pitzerak is here from Salem Regional Medical. Debbie, do you have any updates on that?
Sure.
Debbie Pitzerak, the Vice President of Salem Regional Medical Center.
We have not tested at that number. Again, we're following the CDC guidelines the same way that East Liverpool is. And I do also have to say, one of the strengths of this county is all of the partners coming together. We've been very blessed in terms of some of the interventions that we've put in place. And one of the things I would like to also echo that Dr. Nichols said, we are canceling our elective surgeries as well. And I really would like to underscore the reason why is not because necessarily the risk of the patient, it's to conserve the protective equipment. So that is such a critical element to have in the hands of those caregivers, those first responders. Tremendous need in this county. So kudos if we are able to get that delivered locally. I mean, that's going to be a tremendous effort. We had a meeting in Salem with some of the safety officials and, police departments, fire departments, everyone needs that protective gear. So again, whoever made the comment about if you can donate some, if you have some, I think that's a wonderful thing. The other thing I would like to mention that we are doing too is on Wednesday morning, we're going to be starting an acute flu and coronavirus clinic. And that will be from 9:30 until 5:30 at the hospital. We have a dedicated entrance that we will be using. It will be only for that clinic. It's for any person within our service area. You can be a patient of somebody else, but you are welcome to come to the clinic if you have symptoms. And then a provider will see you and then make that determination based on the screening and the symptoms in terms of whether or not you're eligible for the testing. So I know that we've been hearing a lot of our providers out in the communities. It's very hard to treat the number of patients, the number of requests, so we're trying to do that to increase our points of access. And the other point that I would suggest to carry home to readers and those who are watching on the TV is please conserve your questions, direct them to the Ohio Department of Health. We get hundreds of calls coming in from the community. Do you have anybody who's positive yet? Do you have a case who's positive? And that takes time away from the caregivers because we do try to answer those calls. So again, I would really try to say be mindful of our caregivers need to be working with our patients. They need to be working with our staff. They need to be protecting our visitors, our patients, our loved ones. So again, if the community could be mindful of their questions and direct them in the appropriate ways, there are already mechanisms established for that. So I would just encourage that. And this is a time there's many worried well. So those test kits need to go to those people as a first priority. Those who have symptoms, you hear people call them symptomatic or non-symptomatic, but the people who have the symptoms, the people who are being screened at a higher risk level, those are the individuals that need to be prioritized for those test kits first. Thank you.
Yeah, thank you, Debbie. I'd like to echo that as well. We want to make sure we conserve those resources, so thank you for that. And just so the press and the public are aware, just like today, we're prepared as soon as we have more information, we will communicate that to the public. We will utilize the process that we've established today through the media to make sure that the public is informed so that as soon as reasonably possible when we know. So are there any other questions?
For the medical professionals, you guys seeing any particular symptom or a combination of symptoms, or what are you seeing actually, as far as the people coming in?
Most of the people coming in that would qualify for testing for the virus are people who do have a temperature, cough, and shortness of breath. So primarily, there are some symptoms that go along with COVID-19 that are less typical, but that would be the typical picture that we would see.
Are there any other questions?
One from Mr. Cantor. You said when you were talking about the unemployment situation,
Yes.
and I thought you were going to get into businesses. Is there any relief that will be crippled by this? All what's going on, or the closures?
Well,
or anything?
that is something that is certainly being considered, and as you well know, this is a but we're trying to be proactive, but we're also in a reactionary situation, and I do know that there is minute-by-minute consideration being given through the governor's office and those in leadership as to how possibly what can be done to help alleviate the economic impact it's going to be on the businesses. At this point, I have no news in that regard, though, and I cannot speak for him, of course.
Are there any other questions? I'd like to wrap it up if we could, but we'd take a couple more if they were there. Okay, great. Well, having no more questions, again, I'd like to thank you all for attending. It's important that the public know about the hotline at the Ohio Department of Health. We have that up on the screen. It's also on your handout, your statement that we've provided for you today, so please, if you would, communicate that to the public. And if there are ongoing questions specific for the media, you can contact Laura Foss. She's our public information officer for the county. If there are specific questions relative to the hospital, I'd leave that to them for direct contact with them. So again, thank you for your participation, and we look forward to continuing our cooperation that you see before you today with our county and state as well as federal partners. So thank you.